No, you got to go. See. Oh. Thinking about it.
Good day. I'm Al Richmond, Executive Director of Community Campus Partnerships for Health. It's exciting to have you join us today for this inaugural kickoff session. I'm your moderator for this webinar session. It's special in so many ways because this webinar launches the kickoff to our virtual convening series. The history of historically Black colleges and universities in our nation is the story of a people, a story of their quest for education, the desire and strong commitment to scholarship as a means for upward mobility, equity, and justice. And it's our pleasure to join you today for this session as we start a journey focused on the role of historically Black colleges and universities in research. I want to share a few facts about historically Black colleges and universities. In the past year, a lot of attention has been given to them, but I think it's important to really just kind of honor the legacy of these amazing institutions. Founded in 1854, Lincoln University in Pennsylvania is the nation's oldest historically Black university. There are over 100 HBCUs, or historically Black colleges and universities, located in 19 states, the District of Columbia, and the US Virgin Islands. 51 are public institutions, and 50 are private nonprofit institutions. The number of HBCU students increased 47%, from 223,000 to 327,000 students between 1976 and 2010, with a marked increase in enrollment at these institutions even over the past year. Although HBCUs were originally founded to educate Black students, they enroll students of other races as well. This diversity has increased over time. In 2018, non-Black students made up 24%, or 25, at least almost 25%, a fourth of students enrolled at HBCUs. In academic year 2017-18, some 48,300 degrees were conferred by historically Black colleges and universities, with a total revenue of over $8.10 billion. So I think it's important to highlight again the history of these institutions. As a graduate of Livingstone College, founded in 1879 as Zion Wesley Institute by a group of AME Zion ministers for the purpose of training ministers in the Cabarrus town of Concord, I'm so excited to honor my own alma mater, Livingstone College, founded in 1879. I was a student at Livingstone in 1979 as the institution celebrated its 100th anniversary. Today, Livingstone is a 142-year-old institution, and it's my honor and distinct privilege to welcome you to At the Heart of the Matter, a community engagement award made possible through the Patient-Centered Outcomes Research Institute. You'll hear more about PCORI and its transformative work by our guest presenters today, all of whom have a unique perspective about PCORI. I want to acknowledge that the current award for PCORI is our third engagement award, and that my interest and commitment to PCORI includes serving as a member of the Patient Engagement Advisory Panel. Welcome. Next slide. Community Campus Partnerships for Health is an organization based in Research Triangle Park, North Carolina, whose mission is to promote health equity and social justice through partnerships between communities and academic institutions. The work that we have set forth to undertake through the At the Heart of the Matter represents just that. It's a work focused on health equity and social justice. Our goals are to leverage the knowledge, wisdom, and experience in communities and in academic institutions to solve pressing health, social, environmental, and economic challenges, to ensure that community-driven social change is central to the work of community academic partnerships, and then to build the capacity of communities and academic institutions to engage each other in partnerships that balance power, share resources, and work towards systems change. Next slide. The work of CCPH centers 5 pillars, and they are leading, convening, disseminating, partnering, and training. At any point in time, these 5 pillars are all in play. And through this convening series, we're both providing leadership in the space of connecting and bringing in key stakeholders from historically Black colleges and universities, certainly a work of convening. We will be disseminating the findings and the action plan that will be generated by our series of webinars. We're partnering with a number of organizations, including the American Heart Association, Morehouse School of Medicine, and many other institutions over the course of our convening. And then our work is about training. And so you'll have an opportunity to hear about students who are enrolled at HBCUs who are engaged in a number of training opportunities. Next slide. The At the Heart of the Matter seeks to engage HBCU researchers, patients, advocacy organizations, in topics around cardiovascular disease. We're excited that the Patient-Centered Outcomes Research Institute, in the face of the global pandemic, allowed us to expand our focus beyond cardiovascular disease to also include a focus on COVID-19. And that this convening launches a review of PCOR principles. We'll also focus on cardiovascular disease in the African-American community. Our ultimate outcome is to actually achieve an action plan that will drive us forward and move us forward in our work towards this. The regional convening, we had originally planned this to be a regional convening that would be in person on the campus of Morehouse College and Morehouse Medical Center in Atlanta, but unfortunately the global pandemic did not allow this. And so like others, we've shifted to a virtual platform. And so here we are today. I just again want to acknowledge that HBCUs are an anchor to their community and to their region. This is certainly the case in the Southeast region of the US. Again, I acknowledge that I'm in North Carolina, which has over 10 historically Black colleges and universities. In fact, all of the southern states and border states have historically Black colleges and universities. I suggest to many that when traveling into North Carolina, visiting our beautiful state, that most residents are in close proximity to an HBCU, from Winston-Salem State University in Winston-Salem, North Carolina, to Elizabeth City State University on our coast. Today's inaugural session will feature colleagues and friends who are doing amazing work that needs to be shared, work that will inspire others to take action, work that should be replicated, especially in our communities that are disproportionately impacted by health disparities. It's through this series you will hear from faculty and researchers associated with HBCUs. You will also hear the voices of young scholars who are advancing research, and we will build out an action plan to move our collective work forward. Thank you, and again, welcome. Next slide. So I just want to go provide an overview of our program objectives around At the Heart of the Matter. We have 4 overarching objectives, and these are to increase the knowledge of HBCU researchers and faculty, African-American patients, and advocacy organizations about the work of the Patient-Centered Outcomes Research Institute. It also includes the work of identifying priorities in cardiovascular disease and COVID-19 as it relates to cardiovascular disease research and engagement for African Americans in the Southeast region of the US. Third, to establish a network of HBCU researchers, patients, and stakeholders to support this work and our action plan, and then to develop an action plan to guide and engage stakeholders in addressing cardiovascular disease and also the impact of COVID-19. Next slide. So, in addition to the work with At the Heart of the Matter, Community Campus Partnerships for Health is currently engaged in over 6 national COVID-19 response programs. One of these is the RADx-UP project, which is the Rapid Acceleration for Diagnostics for Underserved Populations. This is based at the Duke Clinical Research Institute here in North Carolina. And through that work of RADx-UP, or the Coordinating Data Collection Center, we are proud to offer 2 funding opportunities that we want to share with you. And we want to do that at the top of the hour, and we'll make sure that we'll put a link in our chat box for these. There are 2 awards, but I want to highlight the first award is the Community Collaboration Mini Grant. These are awards up to $50,000 to community-based organizations and faith-based groups who are doing work now in response to COVID-19. The goal of the program is to improve access to and uptake of diagnostic COVID-19 testing among underserved populations, and for the COVID-19 medically and geographically vulnerable populations. This is a funding opportunity that will be made available 2 to 3 times a year. We encourage you to find out more about it and to apply. We also have a rapid research pilot program, which is funded for up to $200,000 for testing, innovation, and novel approaches to testing. All of this can be found, more of this can be found at the RADx website. Next slide. I want to welcome our first speaker, Fatou Cisse. She is a program officer of the Eugene Washington Community Engagement Team at the Patient-Centered Outcomes Research Institute. I've been talking about PCORI, but she's going to actually provide an overview and tell you more about this amazing opportunity, the work, the transformative work of PCORI. She's a published researcher and former program and policy analyst with expertise in HIV prevention, perinatal care, sickle cell disease, and tobacco control and prevention. She received a BS in biology from Georgia State University and an MPH in international health from Morehouse School of Medicine, which is one of 4 HBCU institutions that have a medical college. We welcome you, Fatou. Take it away.
Thank you, Alan, for that warm welcome. Good afternoon. My name is Fatou Cisse, and I'm a program officer with the Eugene Washington Engagement Awards program at PCORI. Next slide, please. So for today's agenda, I'll give a brief introduction of PCORI. I'll talk about our ambassador program and then open it up for discussion. Next slide. So you may be wondering, as Alan has mentioned, who is PCORI and what do we do? Next slide. So PCORI is an independent, nonprofit, non-governmental organization that was authorized by Congress in 2010. It is governed by a 21-member board of governors, which represents an entire spectrum of healthcare community. PCORI funds comparative clinical effectiveness research that engages patients and other stakeholders throughout the research process, as well as support work that improves methods used to conduct such research. These efforts that we seek to support are to give answers to real-world questions about what works for patients based on their circumstances and concerns. We're excited to say that in December of 2019, PCORI funding was reauthorized by Congress for another 10 years. Next slide. Why is our work needed? Patients, their families, and clinicians face a wide range of complex and often confusing choices when it comes to health and healthcare concerns. Unfortunately, traditional health research, with all the remarkable advances, hasn't been able to answer many of the questions patients and their clinicians face daily. People need trustworthy information to decide which treatment or other care option is best for them. Just as important, patients and their clinicians need information they can trust, understand, and use. Next slide, please. How is our work different from other organizations? PCORI's mandate is to improve the quality and relevance of evidence available to patients, caregivers, clinicians, employers, insurers, and policymakers. For them to make better informed health decisions. We do this by funding research on which care option works for whom and under which circumstances. We focus on answering questions most important to patients and those who care for them. We also aim to produce evidence that can be easily applied in real-world settings by engaging various stakeholders throughout the research process. This makes it more likely we'll get the research questions right and that study results will be useful to all stakeholders given and taken up in practice. Excuse me. Next slide, please. As I mentioned before, our mission is really it's really broad and complex, and part of achieving our mission, we seek to meet our strategic goals, which are one, to substantially increase the quality and quantity and timeliness of useful, trustworthy information available to support health decisions, also to speed the implementation and usage of patient-centered outcomes research evidence, or PCOR as we call it. It is also looking to influence research funded by others to be more patient-centered, and PCORI is unique in committing to research that engages patients and stakeholders on a very large scale. And we are influencing the field of research. We usually like to call it research done differently. Next slide, please. This slide just shows the exact language that was used in PCORI's authorizing legislation, which will be available in the slide deck after the meeting. Next slide, please. So who are our stakeholders? A broad range of communities have a stake in the effectiveness of our healthcare system. And we do turn to these communities, as seen on this slide, to help us guide our activities and the research that we fund. It is important to note that we realize individuals may be members of several communities. As such, we find it valuable to recognize all the perspectives that an individual has experienced across the healthcare continuum. Next slide. And how do we engage these stakeholders? We realize that effective engagement of patients and other stakeholders in research does require a well thought out plan. Because we recognize that engagement can take many shapes and it varies according to the nature of the research, we don't require specific activities. Instead, we encourage applicants and stakeholders to bring their most creative ideas forward. This slide shows the many channels of engagement and how to get involved in the work that PCORI does. For the purpose of this webinar, I will be highlighting our ambassadors program. Next slide, please. Next slide, please. So the PCORI Ambassador Program is one of PCORI's signature activities started in 2012. This is our national volunteer community of healthcare stakeholders who are really working to change the culture of research and ensure it's more patient-centered. Ambassador membership spans the spectrum of healthcare stakeholders. They create connections, collaborate on PCORI projects and initiatives, share research findings, as well as network and mentor. Next slide, please. As I mentioned, in the mission and the vision, it is really related to, in their communities and nationalities, ambassadors are partnered with researchers, lead engagement activities, set national and local priorities, and really do spread the word about the importance of stakeholder engagement research. Ambassadors advance PCORI's mission by engaging in the research, sharing PCOR knowledge, and conducting outreach activities or training in their respective communities. Next slide, please. This slide just highlights the different strategic option, and the program's main goal is to develop a force of trained, well-informed patient and stakeholder partners. One, to build and promote PCOR community, to share PCORI-funded research findings, engage with PCORI, as well as recruit and retain PCOR supporters. Next slide, please. How do ambassadors fit into the overall PCORI puzzle? Ambassadors will be able to fill the current gap in the community outreach and dissemination with local, state, and regional partnership efforts. Ambassadors can start to prime their communities to receive research results and report back with feedback, which can ensure the usefulness of PCORI's work in terms of healthcare decision-making. Ambassadors are a way of galvanizing the spirit of PCORI supporters to demonstrate the value of PCORI more broadly. Next slide, please. Currently, there are over 321 PCORI ambassadors, one of which you'll be hearing from today. And the long-term goal is to really have ambassadors in every state, helping to shift the culture of PCOR. By expanding the influence of PCORI's work, ambassadors can enhance the patient-centeredness of clinical practice and healthcare decision-making. Next slide, please. While the community meaning the ambassador community, primarily functions virtually, ambassadors are encouraged to connect and collaborate outside of PCORI-hosted platforms or events. The ambassador program offers a number of optional activities for networking, peer-to-peer learning, professional development, partnership facilitation, and more. Next slide, please. The ambassador program is a terrific way for you to get to know PCORI. It is also very easy. There are no degrees or certificate requirements and no time commitments. To become an ambassador, you simply fill out an interest form and you'll be required to complete a short training, online training, and that would be it. We encourage individuals of all professional and educational backgrounds to become an ambassador, as the roles may look different for everyone. Next slide, please. For additional information about the program and PCORI in general, you may find it on our website, which is pcori.org, or using the links that are provided in this slide. Next slide. Thank you, and I look forward to a fruitful discussion.
Thank you, Fatou. I'll start off with a couple of questions that have been generated from your presentation today. The first question is, do I need to be a part of a PCORI-funded program to be a PCORI ambassador?
No, Alan, you do not. It is open to everyone and anyone. You do not have to have a current PCORI award or have been engaged in other PCORI activities. So literally you could wake up today, and if this is your first time hearing about PCORI and you're interested, we will do the training. We will inform you about PCORI's work and PCOR, and you'll be charged to actually get out there within your communities, and the communities are obliged to speak on behalf of PCORI and the general idea about PCOR and CER research.
Yeah, I have to acknowledge that I too am a PCORI ambassador with Neely, and so
we have a few of those today.
Yeah, we have a few of those today in many ways. You mentioned some of the requirements, but I wanted to, if you could elaborate a little bit more, because some people might be thinking about, can I take on an additional role and responsibility, and how many hours are there minimal expectations
Sure.
for the PCORI ambassadors? Could you share a little bit about the expectations and responsibilities?
Sure. So once you complete the online form and you do the online training, it is really up to you and your capacity. We have no time commitment requirements or capacity that you may fill within the year. So it's really up to you if you only have a day out of the year, 2 days out of the year. And what we do is we get requests about ambassadors to engage with broader communities. For example, like this platform, there's a webinar. Someone may contact us and say, we need someone to speak on behalf of PCORI from a patient's perspective. And we would reach out to our community of ambassadors, and then you would get to volunteer. So there's no requirement that you must fulfill this amount of engagements per year, or you may dedicate 40 hours a year. So none of that exists. So it's really up to you and your ability. And the program does allow a flexible way of being engaged.
Are you seeing, Fatou, any gaps as it relates to racial ethnic breakdown or across geographic regions where there's, you could speak to kind of the need for additional representation of ambassadors?
Sure. I could give a quick breakdown as far as like the different stakeholder groups that are represented within the ambassador community. Most of the ambassadors are patients. I would say out of maybe, these are all numbers, but about maybe out of 125 to 150 are patients, followed by researchers are the highest group of stakeholders that are engaged within our ambassador program, followed by clinician. The ones that are on the lower end of the numbers are policymakers and purchasers, as well as industry stakeholders. So those are the lower numbers, and we could use more. In terms of ethnic demographic, I don't have that information right in front of me, but I know that even within the engagement awards, there are efforts to engage the larger African American community as well as HBCU. We are currently working on specific awards that are targeted to engaging smaller community organizations as well that may not have the infrastructure to apply compared to a bigger institution or university. So definitely there is gap in there, and we could never have, we can't have enough ambassadors, so there's always a need. And as you mentioned, as the world is changing and there's new areas of interest beyond cardiovascular, with the new COVID, there's definitely a need for representation in our communities with how the COVID-19 is impacting our communities, and to have those voices speak on behalf of our communities.
Thank you so much, Fatou. We look forward to you staying with us and joining us for additional Q&A later in the session. This is great because I think that what Fatou has outlined and shared with you is really kind of the driver on the part of by CCPH to really increase awareness of PCORI and the myriad of opportunities to be engaged with the Patient-Centered Outcomes Research Institute. I became an ambassador, and I'm sure Dr. Williams will share her experiences as well, about 3 years ago. And even hosting and moderating the session today is something that I do as a PCORI ambassador. And so our goal today was also for you to hear about the ambassador program and to really kind of spark an interest on your part to find out more about PCORI and about the ambassador program. So thank you so much. At this time, I'd like to introduce a good friend, very close friend, and someone I've known for a number of years. And actually, I might say that who I really can attribute my engagement in PCORI to her and her team at Vanderbilt University. Dr. Neely Williams, friend, colleague, is the Director of Community Engagement for the Tennessee SEAL COVID-19 project. And ironically enough, I'm also a co-lead for the North Carolina SEAL project. And so Dr. Williams, Neely, and I have an opportunity to converse not only about PCORI, but also about the work that we're doing around COVID-19, respectively in North Carolina and in Tennessee. But it's her work with PCORI as a patient, as a PCORI ambassador that she's here today. She's a patient partner. She's a co-investigator for the PCORI-NET, the National Patient-Centered Clinical Research Network. She's a stakeholder and a board member of the Vanderbilt Meharry Institute of Clinical and Translational Research. She's also a minister and pastor of community concerns at the New Unity Church in Nashville, Tennessee. And she's also a great friend. But also she's a member of the Patient Engagement Advisory Panel. And so I serve on that panel with Neely. And when she's not doing all of that work, you can find her in her garden where she has beautiful greens that she's growing their collard greens, green beans, tomatoes,
Yeah.
and she's also canning and freezing and all of that. And so if you're in Nashville anytime soon, stop by her house.
Yeah.
I plan to be there soon or get her to send me some things. Neely, you're a friend, you're a colleague, you're a mentor. So glad to have you here today. As also a PCORI ambassador. And so someone, Stephanie, is saying that she's stopping by.
Please do. Real easy access.
Real easy access. So we're glad to have you. Neely, share with us more about your experiences as a national leader in PCORI.
Well, thank you so much, Alan. Thank you for sharing those kind words with us. And it's such an honor to be on this team. I recognize that I am not a long ranger. I am a team player, and I have loved this work that I have been able to do now from the very inception of PCORI. So doing the phase 1 of PCORI, I was able to interact with the patient-centered, patient-powered networks, the PPRNs, and develop relationships there that are long-lasting and lifelong lasting, and just to be a part of a team that started something that had an ultimate goal to make a difference in the lives of a common person. I apologize to you all today for not having my slides already prepared. I have a team of folks, though, that will help me put this on slides and make it as a historical part of this series, because I do want to share some centering points. I could talk to you about PCORI for a very long time, but I don't want to do that today. I really want to plant the seed as an ambassador. I think that Batu did a wonderful job of describing the program and allowing you to understand that this is about promoting what's there that can help people that they may not be aware of. And so bringing that into the environment and to the rankings of the community where it matters. And one of the things that happened when I started to think about this, when I got the short notice about being here today, and no pun intended, I thank this team for inviting me. I am never put off by the length of time and all of that thing. We are all in this together, and anywhere I can help, I want to be. And Al is just dear to my heart. He's that big brother of mine, that little big brother who is always there for me, concerns, calls me up and say, go to bed sometime. You know, in short and brief, that's exactly what he said to me. You need to stop. And I do enjoy the activities that he shared, and those are my centering moments. That's how I am able to function. When I move away from the desk, this room where I have now become my office here in my home, it becomes non-existent. And the only thing that exists is my yard out there and the things I'm growing and the things I'm gathering to put in the freezer, and concerned about where will I find space to put them, because all of them are full. But I'm a sharer also. So if you make it by here, I promise you won't leave without something. If you have any interest in homegrown, loved products and things that grow from nature, we are all about it. That's how I was raised. That's where I was born. Now, to this presentation, and let me say this as briefly, and let me stay on task as first as can. The thing that came to mind was two things: making sense of the suffering and having the lived experience inform clinical research. These are the themes that have governed me over these last, what do we have now, 12 years? When I entered this process, I was a patient who had had many different conditions that were part of the research that was being done, or attempted to be done, the plan. I was there when we had our first annual conference, and we really didn't have anything to report, but we certainly did have a good time. Because what that Joe allowed us to do for that conference is to build a community of folks that would press forward and go together to make this something that would be long lasting. And yes, we did face that period of uncertainty, and we made moves that we found not to be completely necessary, but thank God for the safety gaps. and the safety net that had been provided to keep this work going forward. So we've spent some time readjusting ourselves and making ourselves as PCORnet to be a part, the vital part that we serve with PCORI. And I am part of the governance of that process. And I feel so very welcome. And so under those themes, as a patient and as an ambassador, those are the things that have governed the way I approach each and every situation. When I'm sitting in a conference room or I'm in a dialogue, a meeting, a working meeting, and I hear the workings of people who are analysts and statisticians and researchers, I have to often remind myself what my expertise is, and that is the lived experience. And to that, as I have climbed the ladder of being responsible to carry the voice of a patient further, I have learned some things about advocacy. Advocacy was a big part of my doctoral program. And I am grateful for that because it has allowed me not to just have a voice for Neely, but a voice that represents patients everywhere, listening to what patients have to say in every situation as it relates to their health, every possible situation as it relates to their health. Certainly that has been a monumental task to carry out for both Al and I as we work in the work of the SEAL project that addresses educating the community about the disease of COVID-19 and the vaccines that have been made available. So we are taking a holistic approach to the whole state of Tennessee. We are behind. We are one of the states that had the highest rising, the lowest number of folks vaccinated. And that is very unfortunate, but it keeps me up at night when I have to deal with what I had to deal with 5 minutes before this conference began. A young lady I had pleaded with on last evening to please go back to the hospital. And this morning, her granddaughter found her dead. And she had COVID-19. And that is, she had tested positive on Friday. She had gone to the hospital on Monday. They had sent her home with medicines. And when she got home with the medicines, when we tried to get her to go back, family members along with me and others, her children, tried to do all that we could last evening to get her to go back. And her persistent answer was, no, I'm not going back to the hospital. And Carolyn was in her early 50s. So keep that family in mind and the many other families who lost loved ones to this COVID-19 situation. And as an ambassador of PCORI and the much work that's being done through PCORI and the efforts that's being made by those that have been funded by PCORI to address this issue in our community, I am humbled and grateful to be not only a part of the beginning team of PCORI, but the ongoing team into phase 3 of COVID-19, of PCORI and PCORnet, the network of agencies that work to do clinical research also along with PCORI. This work has allowed me as the patient-centered approach allows patients and stakeholders to do 5 things that I have identified for you today. That is to establish the direction of research that will enhance the science for researchers and be research that matters to patients and other stakeholders when it is completed. Number 2, the patient-centered approach allows us to consider the possibility of the impact of the study before the study has begun. That helps us to make sure that we're asking the right questions and we're going in the right direction. To develop a plan for the actions, an action plan together as both patient and as researcher and scientist. To participate in the production of the study results, identifying those things that have been considered to be findings as they do the analysis of the data that's being collected from the research, and having that patient voice be a part of that. To create a plan of dissemination for findings, to the community that's directly impacted by the research, whether it's cardiovascular or diabetes, obesity. I have been so humbled and blessed to be able to serve at the highest realm as a co-investigator of the PCORI diabetes study that happened about 3 years ago now. And we are still publishing the results from that study. So we are just, I'm elated and grateful to be start out as a patient who really had no understanding at all, really, of the published author components of being a part of research, and now can attest to, I think the last count someone shared with me was nearly 30 articles that I've been able to be a part of, to do feedback on, to participate in the design of the outcome and the discussion. I am humble and grateful, and I am determined to make sure this door is wide open for others who desire to do something of that nature. It is just part of my being, and I recognize that as I'm at the close of the day and the work that I do, that's not a bad thing, because it's really good. It allows you to have a different posture, a different way of thinking about your work. You're not working so that to prove that you can work. You're working because you've already been proven. And now you can share back, pour out, want to be empty, want to support the youth, younger people as they come forward, and those passionate advocates for people who want to make a difference in the lives of folks. I'm gonna give you one more brief list of things, and then I'm going to allow to close this out. And that is around equity and inclusion. And I'll do this in a thumbnail sketch. And I think I developed about 7 points for this one, which was partnership, sharing of responsibility and decision-making from the beginning to end, valuing of the lived experience and the voice of patients, respect that is authentic, physically, emotionally, and intentionally being heard by the research team, emergence of a shared vision and goal, open bi-directional communication and learning, the use of common language that supports and enhances the real community. These are things that I've experienced as doing this work as PCORI. I've been an ambassador, not just for the 3 years that I have been involved with the PEAP and the official title of being an ambassador, but I have been an ambassador for the life of PCORI. Anyone that talks to me know that I'm going to say something to them about the work that I do and how it impacts their lives. And I was the typical person who walked the streets of Nashville to help those who were being torn apart by HIV, domestic violence, human trafficking, and many other youth violence. I had worked in those things many years before I came to PCORI. And my response was, I don't know what those researchers are talking about. I don't know any reason why so much money is put into research. And now no one can beat me being excited for the opportunity and helping people to understand that they are being researched whether they want to be or not. And the ultimate goal is to be involved in the process so that your word, your voice, and your understanding impacts the way it's done. So I feel invited, welcomed, engaged, supported, encouraged, heard, respected, valued, appreciated. And I have done all of this at PCORI in the environment of a team. And I want to encourage them to continue forward as they continue under the new director and the work we have in phase 3, create that environment so that more patients, more stakeholders can be involved in the process. And I apologize if I went over your time, Al.
No, Neely, that was so inspiring and amazing for you to share your own testimony. I think we call it testimony here this afternoon.
Yeah.
of the work that you're doing, but also the difference that PCORI is making. I want to acknowledge in the chat box just some wonderful comments from many people that are saying, Neely, thank you so much for your work. others that are just, I think you've got some converts here this afternoon between the two of you for our PCORI ambassador program. I think people are being inspired. I wanted to just take a moment, Neely, to unpack some of the things that you said, in particular for people who may be new to this discussion around research. You mentioned your role as a co-investigator. What does that mean? What are you talking about? What is that all about?
What that actually unfolded to be for me in that study was the intentional support of being a part of a major research project. I believe it was $4.5 million that was only funded for, I think, 2 years to do this work. And I actually took on the role of the investigator. It was 3 of us sharing that investigator role. And because of my colleagues who were both the science end of it, and one was the operational end of the study, I was the patient engagement end of the study. And so I shared the responsibilities with others who worked on patient engagement. And that was a challenging task because we were dealing with PCORI's raw data. We were not talking to patients in this study, but there was certainly a need to hear the voice of patients as we develop the questions and to do the analysis and to even in the dissemination, because the work that was being done about obesity was going to have and is having an impact on the lives of living people. So people, when the research addressed people, people need to be part of the research. Mm-hmm. And that was the prospect, that was the posture. And as they say about the book stops here, the book stopped on 3 investigators, one of whom I was. I tell people I was not a patient investigator. I was an investigator that was a patient.
Mm. Wow.
And I think
you were an investigator who was a patient.
Yes, because we minimize that role when we say, well, he or she was the patient investigator. No, they were an investigator who was a patient, just like there was an investigator who was the operational oversight person and an investigator that was the science oversight person. And mine was the engagement oversight role. And it was a field that had not been developed in the PCORI realm. And so we left as many tracks as we could to make sure. I've done presentations at PCORI about my experience and gave a linear diagram of how it unfolded through the times. One of the pivotal points was the day that I said to my co-investigators, anything that goes out of this study that has your name on it should have mine also. And they looked at each other and said, "You're correct." And that from that day forward, if it went out of the obesity study, it had all our 3 our names on it.
Neely, you talk some about, and all of this actually is really about lived experience, but you lifted that up and that you mentioned that your expertise is around your lived experience. Say more about that idea about our lived experience being so important, so valuable.
I think that's a point that we need to make sure we have in our training for patient participants and not patient participants, but patient partners in our research. We have to approach this thing so that people are not comparing lemons to oranges or lemons to apples. If a patient walks into on a study team and feel unvalued or not valued because they don't value what they bring to the process, then it's our job to make sure they understand where their expertise lies. So when they walk in that meeting, they don't feel intimidated because they're not an analyst or a statistician or any of the other roles that's being played out in research. They come and that's the poise we want that patient partner to continue to hold. It is true, all of us are patients and all of us have been patients, but all of us don't go into the research team process looking through that lens. I might be a patient, a hard patient at the time that I'm doing an analysis. Someone might be an analyst, and that doesn't stop them from being a patient as a hard patient in their in their life experience. But when they come to the work of that study, they are there to make sure the analytical components of the study is as they should be. And so a lived experience of patients, if we are able to help them to value what they bring, and for us to value what they bring to the process, and help them to understand where their expertise lie, and help them to stay in the church. They say, stay in your lane. So stay in that posture, stay right there. Don't think it's not worth being there because, well, I don't know all those things, and I don't know all those terms, and I don't understand what they're talking about. Just stay in the room. Stay in the room, and you'll hear it long enough, and someone will come right behind those people and break down that statement, and that person might even come to you and I say, I apologize for using our lingo, or using a lot of acronyms. For those who are my colleagues already know what that means. If I say NIH, ain't nobody that's part of the research world would be lost. But someone who teach children every day, someone who takes care of their mother, or someone who works in the nursing home, may have no clue about the National Institutes of Health initiatives and what their role is. So those are the kind of things that helps us to build strong patient partners. And we got to make sure we also choose the right P. There is a place in all research for participants, but there is a patient partner that's not the role of the patient partner, to be that participant and helping gather that data, but to be a part of designing that study and holding it to the lens of patients.
Well, this is amazing, and I'm going to move it forward. I just can feel the spirit just flowing here this afternoon. And Dr. Kareem Watson, our board chair from Chicago, just notes that it's such an important statement to lift up the value of the lived experience of patients. And Dr. Paris Davis, who was our next speaker, highlighted bold font there, stay in the room. That make a good sermon there, Sister Davis. Preach that one on Sunday there. Yes, ma'am. Just stay in the room. I feel that. So I just want to say, Neely, thank you so very, very much this afternoon. We're going to acknowledge others, but I just want to move forward quickly with Dr. Paris Davis, who also is a friend and colleague out of Chicago. She too is a PCORI ambassador as well. She's an ordained elder at Tridestone Church of Chicago. And in 1999, with a colleague, Bishop Simon Gordon, founded a community development organization that today provides tremendous services, including utility payments, housing, and other resources for individuals as we transition to her slides here. Yes. And she has over 30 years of senior management experience in the for-profit organizations such as IBM, and as senior project manager with IBM and Harris Bank as a vice president. But it's her work with the Patient-Centered Outcomes Research Institute in Chicago that brings her here today. She serves as the principal investigator for Pastors for PCOR, an amazing and phenomenal project based in Chicago, which is in its 7th year as a 3-time funded Patient-Centered Outcomes Research Institute engagement awardee, and serves as one of multiple PIs with the Northwestern University and NIH for the Decipher Circle project, based also in Chicago from 2020 to 2027. Currently, she is also honored and has been selected as a part of the White House Faith and Community Engagement Task Force, author of many books. And I want to highlight 2 of those books. One of them entitled Engaging Faith-Based Communities with Health Research, and a handbook for building community serving faith-based entities. Dr. Paris Davis, friend, colleague, welcome this afternoon. We want to hear from you and about the work that you're doing with Pastors for PCOR. Again, a novel approach. I want to applaud and recognize PCOR for funding this kind of work, which I think is so cutting edge and really speaks to where we are today, even in a global pandemic. Dr. Davis.
Thank you so much, Al. You're letting me know how old I am with all those other things that you just named off. Good Lord. And Dr. Williams, I could pretty much just sign off right here because you're all in my PowerPoint. So I don't know, maybe we can get a few minutes back to our day, but Al probably wouldn't like that. So I'm gonna go ahead and get started. And so what we have here, and of course, I got to give recognition to our team, which includes Bishop Simon Gordon, who is our senior pastor and chairman of Pastors for PCOR. Regina Greer is one of the founders of Pastors for PCOR, and I know everybody with PCOR knows Regina Greer. And then also two of the key trainers that have worked with us from the very beginning are Dr. Diana Ingram and Dr. Rebecca Johnson, who have just been instrumental in helping to deliver the training, create the training, keep our people engaged, and get us to where we're at right now. So we have the researcher, we have the statistician, and we have the bishop to continue to pray for us. So with that said, I am just honored to be here, Al. Thank you so much. Kudos to my friend Kareem. I did not know that you were at the head of this, so I'm extra excited about it now. But if we can, what I want to do is give you an overview of our primary goal for Pastors for PCOR, and that is establishing a way to connect stakeholders that would be empowered and equipped to deliver tangible results, things that make a difference in their lives on behalf of those that they were charged to make their lives better. The Pastors for PCOR entity itself provides faith-based community members with skills, knowledge, and training to talk the same language as the researchers and stakeholders that they need at the table to get done what we need to get done to help our communities be better, and to empower and enable the community layperson to sit at the table and be heard at the top, not at the bottom, not at the middle, but at the top of projects going forth. That's Pastors for PCOR's overall mission. And what we found was that to do this well, not only in the moment or for a duration of a program or project that's coming down the pipeline, but with sustainable results while making an evidence-based impact, tangible impact, if you will, on the lives of others. We are now in this since 2014. So we're not going anywhere. And you'll see as I get through the presentation here, how we have put our footprint in the community and how we are putting our stakes down to continue to build and go forth and what PCOR has entrusted us with since 2015. So PCOR has enabled us to not only to hit our community, but to expand across the country while keeping our heart focused on the needs of the families within our immediate community, especially during the pandemic. Our doors never closed, especially during the pandemic. Ministry for us as a faith-based entity and as people in the community makes life make sense. So who are we? I think I was ambitious to do my own slides, but that's okay. So who are we? This is who Pastors for PCOR is. One of the things that we knew, especially as business people and faith-based people, was that we had to state who we were in a language that those outside of the church would understand. And so that they would know we were serious about playing in the same field that they're playing in to get results. And so our vision is to inform, inspire, and engage congregations in research through partnership. The mission is a partnership of faith-based communities, health researchers, and other stakeholders working together to create a survey skills training program for faith-based communities members supporting health and well-being. In other words, teaching them how to fish for themselves, so they're not always having to come to somebody else's pond to get what they need. And so we also knew that we needed to make a distinction between a faith-based community and the church. We wanted to be broad enough, no matter what your faith is, no matter what you believe in, that what we were bringing forth would work in your community. So a faith-based community is driven by a group of people of faith who share a common interest relating to spiritual, social, and or cultural matters within the areas that they serve and live. Whereas a church, also known as a faith-based entity, is generally a legally structured organization driven by a group of people of similar faith to meet a specific purpose within its community. Also, for those of us that are in the traditional Catholic Christian church, we know that that's considered an organism because it's made up of living participants, right? And so we wanted to make sure that one of our key goals with Pastors for Peace Corps is that everybody's speaking the same language. There is no coded language that we are not able to translate to be able to sit at the tables that we need to sit at. So we knew starting that out, we needed to get the church, the faith-based organism, if you will, up to date, running high speed at the language of the researchers, at the language of the medical and academic researchers and the community stakeholders, so they would realize that we're serious about this. We're not just meeting on Sunday. We're ministering to the needs of people and meeting them where they're at Monday through Saturday, and then we come back Sunday to recharge. And so that is who Pastors for Peace Corps is. And so now, with that in mind, if you will, walk with me for a minute. As a faith-based entity, yes, we do have scripture that undergirds us. So I'm gonna just throw out Luke 2:49, which means be about my Father's business. Be about the business of serving others in the community. Engagement is finding the common ground within disciplines, everywhere from business to academic to medical to government health departments and entities and the community at large. Whatever that may look like for you, you have to be able to customize what your community engagement program will look like. And so what is that? What is that business? It's coming together on one accord to meet the service and administrative needs of those in need of resources that will help where they are currently and give them a better life in a long-term state. So starting out, we found that there were 3 principles that are in our engagement toolkit that help support our model. The first one is collaboration. That's the situation of 2 or more people working together to create or achieve the same thing. More formally, a collaboration is a working practice, meaning a way of doing things consistently, not wavering, consistently, whereby individuals work together for a common purpose to achieve a business benefit. It's not always in dollars. Benefits come in many ways. And this looks at the qualitative. This is where the accountability comes in. Are you doing what you said you're going to do? How do we hold you accountable? This looks at the qualitative side of sharing and serving in the community and its members. The next one has to do with partnership. A partnership is a formal arrangement by 2 or more parties to manage and operate a business and share its benefits. This looks at the quantitative side of serving and supporting others. This is the working together. Collaboration is the walking together. Now we figure out, okay, we can walk step by step together. Let's see who we can work with out of those that we've already had the handshake agreements with. Then we move to relationship. This is the way in which 2 or more concepts or people are connected. It's the state of being connected. When you're in the relationship with someone, you're way more accountable than the handshake agreement of collaboration and the legalized agreement of a partnership. Now you start to get the humanistic side in it. I'm human. I love you because I serve you because I'm going to help you because we're all a part of humanity. And so deciding to be in a relationship means that you're also choosing those that are going to be on your team. Again, This is the human element. So no matter where you're working, what your profession is, where the community is, or where you are personally, this is living together. Living together means from sun up to sundown, some kind of way our paths are going to touch, and I want to make sure you're okay. So relationship is really at the heart of engagement. It's crucial for how we survive as a human race. And so we've got to make sure when we're doing this that we're intentional, we're honest, and we have a purpose, and that we're able to engage at various levels. So going into this, now you may be thinking, and I'm glad you asked, Dr. Paris, what does that look like with Pastors for Peace Corps? What I have laid out here are our direct connections with PCORI. PCORI gave us our steam and power to make an impact beyond what we even thought was possible. But from the day we were introduced to PCORI by Regina Greer, it has not stopped. It has been full steam ahead. And in the midst of that, bringing us the understanding of comparative effectiveness research, which is the direct comparison of existing healthcare interventions to determine what works best. In other words, just like you can customize your community engagement strategy, you can customize what you're bringing to the community to help them get the best results and benefits from what's there healthcare wise. The goal of comparative effectiveness research is to generate better information about the risks and benefits and costs of different treatment options in order to make better, more informed decisions at the patient level and at the caregiver level, meaning the medical healthcare workers that are working through the process. Per Johns Hopkins, the core question of comparative effectiveness research is which treatment works best for whom and under what circumstances. So it's critical that we be at the table at the beginning where we're looking into as what is known as researching solutions for those within the community. What PCORI allowed us to do was, one, put our ideas down in 2014 and say, you know what? This was birthed out of about 10 pastors sitting around the table. All of them had the same diabetes medicine, but all of them had different pre-existing conditions that related to heart disease, that related to obesity, but they were all on the same diabetic medication. That caused them to say, you know what? We need to be at the table sooner. We need to figure out where that infrastructure starts. And so what we did from there is we brought together, excuse me, we brought together members from each one of those churches to come and sit at the table and say, okay, what do we need to know? How do we shape that? What does a curriculum look like? Out of that was birthed the first PCORI grant. That's that next grant in 2016, it had to do with now, what do we need to be at the table with researchers? One, we need to talk their language. Two, we need to be IRB certified, which is unheard of for the church. We need to have IRB certified members. We also need to teach our individual research ministry ambassadors how do you survey the church that you're in, because as most know, Chicago is huge. So what's an issue on the south side may not be an issue on the north side. But if you're on the north side and you're creating this survey that you've been taught how to do in your church, and you're able to come back with the top 3 to 5 health components that need to be addressed, then that's where we start to connect you with the researchers you need to be connected with. We thank God for Northwestern and the University of Illinois and the University of Chicago, and those that were open enough to say, okay, we're ready to sit at the table with you and not just dictate to you what we want to do in your community, but hear from you what you need. That brought us also to the second PCORI grant, which helped us build a curriculum called Train the Trainer. Now let's duplicate ourselves where you can go out and do what we're doing wherever you are equipped to do it. And then the third PCORI grant had to do with establishing a community hub. meaning that, okay, instead of everybody having to go in various places to get the resources that they need or to figure out who to help them research-wise, let's centralize that. And so what we've been able to do with this third round of PCORI funding is actually build a model of how to implement a community hub, if you will, no matter where you are. And each one of those circles that you see on that hub has a stakeholder from that particular community. So what I want to do here is for each one of those that I just showed you, I know it was too small for you to see. I know it's too small for me to see. Each one of those, we did one of these fabulous picture boards, if you will, poster boards. Now, coming out of the business world, I had no clue what this was. And when we were invited to do our first one, all the researchers were like, this is great, this is wonderful, this is great. And I'm wondering, what is this? And so as they began to talk to me about it, what I began to find was that for each project where there was a poster board, it tells the whole story. And so my statement to them was, are you referring to those science project poster boards? You know, they didn't teach us about poster boards with an MBA, right? So this was new, this was different to us. But once we started looking at it, it made it make sense because it captured everything relating to each one of those projects that was done. So my statement to those poster boards are, be open to learn everything you need to empower you to help the community that you serve. This is the last leg of the community hub that I've blown up. So you can see that each one of these, what we call our spokes in our core, but each one of these spokes has a stakeholder that is now engaged with Pastors for PCOR so that we can hear their voice and what they're doing, and they can hear our voice. Let's see. And so following that, our results have been that since 2014, we have trained 33 Chicago and 26 in Arkansas research ministry ambassadors. What does that mean? That means that we have replicated ourselves, if you will, where they can actually go in their churches or in their faith-based entity where there are health ministries, or even establish a health ministry, and then teach them how to figure out what the key health components are that need to be addressed, and then connecting back with Pastors for PCOR to get researchers involved with them to start looking at what solutions are there or how to customize solutions for what they need. So then also what we have done is brought in researchers from the majority of the major entities that are surrounding us, such as the University of Chicago, University of Illinois, Rush Hospital, Cook County Hospital, Stroger, those hospitals that are around, especially Northwestern and Loyola. And so depending on what that health disparity is, we connect you with a researcher. If it's mental health, that's IIT. If it's blood, if it's heart, that's Northwestern for us right now. If it's cancer, that's U of I for us right now. And so then what we were able to do is train trainers who could go out, 16 in Chicago and 6 in Arkansas. We have 55 faith-based entities in our network. And right now with our hub, there are 10 trained IRB certified research ministry ambassadors that have connected with 125 community-based stakeholders. This is so that we can continue to reach out and stay current and be on top of whatever is coming down the pipeline. And so here is a real-time example. Pastors for PCOR is multilingual. We speak multiple languages. We speak faith-based. We speak, and even in faith-based, we speak Baptist, we speak Catholic, we speak Protestant, we speak multiple languages. We speak research. We speak medical and academic. How are we able to do that? Because one, we've sat at the table, we've listened, and we're teachable. We've sat at the table, we've listened, and we're teachable. So in exchange for that, we've also been able to teach researchers how to hear what the community is saying and the faith-based community is saying, so that when they sit at the table, they're able to talk to one another to get past all that. At IBM, we used to have an acronym for everything, to get past that, not knowing what's being said. And so here's a perfect example. One of the projects that I'm an MPI on with Northwestern at the NIH level for Decipher and Circle that deals with heart disease and how to address that in our communities. So we started out with their research mission. And so one of the practices that we've put in place with this is you can have your research mission, but you also got to break it down where the community can understand it. So if you look at the top one, that is the long mission statement of why we're doing what we're doing with the Circle project. You can't get before the community and throw this at them and think they're going to know what you're saying. And so as we thought about it, we said, well, let's address the why you even want to engage them. And so what you see below is a translation of what you see above. And there is no one that's on our staff that cannot take that apart and explain it either before the congregation, before a ministry meeting, or even one-on-one, because we've broken down the why and how that individual can benefit from it. At the end of the day, you need to have a personalized treatment plan. That's very straightforward. Other than throwing at them, it needs to be related to the Kaiser bundle. Okay. And so with that said, I want to leave you with some lessons learned from the community. Engage well in advance, come to the table and to reason together regularly. I shouldn't see you every 6 months if you're supposed to be doing a weekly or monthly program. Work together to deal with barriers to entry, such as expertise, resources, finances. You can't forget that these are faith-based entities. We got to pay the light bill when you're having a meeting. There are things that have to be met when you're coming in. You should compensate people for their time. Stay focused on the task. Don't get distracted on things that aren't relevant to what your real assignment is. Be respectful of time and resources on both sides and be open to workarounds. From the researcher side, what we have found is that also engage well in advance. We used to have a saying, and I'm going to date myself again, we called it a Rolodex in the business world. You should have a Rolodex. You should have already established that relationship with those that you meet at the table. So come to the community table to reason together regularly. Work together to anticipate barriers, be aware of legacy things like data sharing, researcher behavior, and even the institutional behavior. All institutions aren't on board yet for smaller entities coming to the table. So as the researcher, you've got to be the advocate, if you will, for those that you want to work with. Stay focused on the task and always feedback the results. Don't come in and steal my data and then don't come back and tell me what you did with it. Be respectful of time and resources on both sides. Be aware of the impact research engagement can have on a community and be open to workarounds. Don't be so staunch that if I say I can't meet at 5, then we can't do it at all. Well, what's open for you? And always remember, nothing about us without us. Research is for all of us. Thank you.
Thank you, Dr. Davis. Amazing. I want to lift up a couple of points that you made in particular, but I think that with the time that we have remaining, I want to really just ask you as an ordained minister, how have you kind of, you've shared some, but how have you kind of like translated this work among your peers and colleagues? What was that experience like? And what are some of even the challenges and barriers that you faced and overcome?
Main to that is that I came in with a business background. And I came in with the ability, along with my peers, to translate that down, to take the large, overwhelming concepts like that mission statement and make it make sense. Break it down into bite-sized pieces, taking the language and making sure that everybody is able to understand the language. If there is a word, there is not a single word we can put into the community that we don't understand what it is, or if there is a way to make it a simpler concept, then we do that. the challenges and barriers that we had initially. We don't experience it so much now, Al. So I guess we have built up integrity, and we're trusted on both sides. We're a trusted voice to both sides. But initially there was some resistance to the larger entities. Saying, oh, here comes another church. I'm just being honest. Here comes another church. We've dealt with them before. And sometimes even thinking that we didn't have the intellectual capacity to meet them at the table where they were, and then be able to be a value add to what they were attempting to accomplish, and letting them know we together can be exponentially more successful than what you're trying to do on your own and what we're trying to do on our own. And what we are all trying to do is make the lives of others better for the long term, not just a hit one and done, but for the long term.
I certainly can see where your acumen in business really applies and has surfaced in this work, where you're kind of building this win-win proposition, which is sometimes not fully understood by either partners. And so therefore we have kind of this polarization that takes place where communities or faith-based groups are kind of isolated. They're in their corner, and then the healthcare system, researchers and others are in their corner, and the two shall never meet.
Yes, yeah, yes, they will. Because we Dr. Johnson, Dr. Ingram, and myself, and Bishop Gordon, we all function from the aspect of knowledge is power. The more we can increase your awareness about a thing, the more we can give you access and exposure to things that impact your life daily. Knowledge is power. And so if you don't know, ask somebody. Somebody can help you. But at the same time, we've got to pull them out of isolation. And when I say them, I'm talking about the community now. You've got to come on back out. You trust us as your faith-based leaders. Therefore, we're saying and we're vouching for the researchers coming into the community.
Thank you so much. We've enjoyed all of our speakers today, and we want to wrap up by just kind of having a little open mic time here this afternoon. And so I know that several of you wanted to have specific questions. I wanted to go back, and I saw that a couple of hands were raised. Ernest Hopkins, are you still with us this afternoon? If you are, we can just, if you'd like to unmute your mic, you had a question. Okay, Ernest may have left. Okay. Are there any others that would like? Yeah, Ernest?
Yes,
Yeah, I believe you had a question for one of our panelists.
I did for Dr. Neely Williams. I was just interested first just to say that what great work that everyone is doing. I was curious if any of the speakers are open to their information being shared, and is that information available? Can I get that information sent to me? Is that possible?
We absolutely can make sure that you get that information. We'll share a list of our speakers. This is a webinar series, and so there'll be future sessions. We'll have another one in early September. And so we'll invite you to attend that one as well. And we'll make sure, in fact, we can kind of create a list of all the speakers that have been with us. Yeah. So
Okay.
really great.
That would be great. Thank you.
Thank you. Fatu, we have a question for you. Let me find it. If your organization has a PCORI grant and may apply in the future, would it be appropriate to apply to be an ambassador?
Thank you for that question. Yes, it would be. We want you involved not just in the research aspect, but in all forms of the community. So being an ambassador adds just another layer to reach people that may, for example, what Dr. Davis was talking about. There are certain people in our communities that may not know about PCOR or have never heard of it. So being an ambassador creates a pathway to reach those people and actually be involved in the communities beyond just research.
Thank you so much. Erica, you have a question. Erica, if you would unmute yourself. Okay, she's lowered her hand. Others? Any other questions for any of our speakers? Great. I want to thank everyone for joining us. Thank you to our speakers this afternoon. Stay connected to this work. Visit our website where you can find more about At the Heart of the Matter. I think this has been an amazing kickoff to our webinar series. Stay tuned for more. We have future sessions coming up that will feature speakers from Morehouse School of Medicine. Also, we'll have a session that will be by young scholars and researchers at historically Black colleges and universities. And we'll top it off with an action plan day or a town hall meeting. Find out more about our work again by visiting our website at ccphealth.org. Please send me an email response to al.richmond@ccphealth.org. It's been my pleasure to host and moderate this afternoon's session. I want to acknowledge our staff, Kimberly Hyman Ming, but also Paige Castro Reyes and other members of the CCPH team that have supported the production of today's session. This session and future sessions will be have been recorded and will be accessible on our website. We will share with you shortly a link to our evaluation where you will have an opportunity to provide us with feedback about this experience. Thank you, Samuel and others, Mario and others from the University of Pittsburgh and others throughout the Southeastern region who have joined us this afternoon. Please share this opportunity with others, in particular your friends and colleagues at historically Black colleges and universities. Again, thank you, Dr. Williams. Thank you, Fatou. Thank you also, Dr. Paris Davis. And to all of you, have a wonderful afternoon.
Thank you.
Thank you.